One of the parts of IVF that can be really overwhelming, especially if you're new to the world of infertility, are all of the medications that you're going to need to use throughout the process. So let's break them down step by step, what the medications are and what they do in your body. So the first group of medications are typically the medications that stimulate the eggs to develop within your ovary. And these are typically some form of gonadotropin. The main three that we see are Follistim, Gonal-F, and Menopur. Follistim and Gonal-F are pretty much identical. They're just two different forms of the same compound. And then Menopur actually is one of the medications that comes from humans. It's not synthetic. It is a form of gonadotropin that is derived from the urine of postmenopausal females. And originally it was nuns, which is kind of interesting when you think about it. Now it's still the natural form of gonadotropin. The other two are synthetic, but they're all equally effective. And usually you'll use either Gonal-F or Follistim, and then you can add Menopur to either one of those. You don't typically see Menopur on its own, but sometimes that's also the case. It all depends on exactly what your clinic uses and what your needs are. The next type of IVF medication are the suppression meds, and these are designed to prevent your ovary from releasing those mature eggs until we want them to be released. And this is important with IVF so that we can time exactly when those eggs are going to be released so that we can harvest them. Otherwise, if they're released naturally, there's no way for us to know when to go in and get them. And these medications are typically ganirelix and cetrotide. Also, sometimes leuprolide is used in this step. They're pretty much interchangeable. They're all equally effective. So then it's time for the trigger shot. This is how we tell your body, we stop the suppression meds and we move and give a trigger, and it's exactly what it sounds like. It triggers your ovaries to release those mature eggs, and we use the timing of the trigger to know exactly when your retrieval is going to happen. So these are really important to use exactly when your fertility team tells you to. And it might be at a really weird time of day, you might have to readjust your schedule around it, but this is really important when it comes to timing. The three most common medications that are used for trigger are Ovidrel, Pregnil, and Novarel. It also comes as a generic human chorionic gonadotropin. Those are all your standard trigger shots. Again, equally effective. Between them, it all depends on insurance coverage and what your clinic prefers. The final most common medication used in IVF is progesterone, and this is going to be part of the final transfer process. Normally, when you get pregnant naturally, your body releases progesterone to help ready your uterus for an egg to implant, and it also helps that new embryo attach and mature and develop properly. Well, we're creating basically a faux cycle with all of these medications, so your body isn't going to be producing progesterone naturally. So we give progesterone to make sure that it's at the level it needs to be for that fertilized egg to attach and grow. The most common form of progesterone that's used in IVF is injectable progesterone in oil, which is a compounded medication, and it's typically injected into your backside, into a muscle. It also comes as vaginal tablets, vaginal suppositories, vaginal cream. There's lots of different forms, and again, they're all equally effective according to clinical studies. A lot of which form of progesterone you use depends on your age, your medical history, your insurance coverage, and what your fertility clinic prefers. This already seems like a lot. There are a lot of additional medications that may be part of your cycle. These include things like leuprolide dilutions, sildenafil suppositories. You heard that right. It's Viagra. It helps increase blood flow to the uterus and the vagina to help with the fertility cycle and implantation. You may take things like Clomid or Letrozole tablets to help prep your body for a cycle. You may use estradiol or estrogen tablets or even progesterone capsules to prep yourself before a frozen transfer. And Omnitrope is another miscellaneous medication that's being used more often in the stimulation cycle. So this isn't a definitive list. Everything is going to be customized to your specific needs, what sort of cycle you're doing, if it's a fresh transfer, a frozen transfer, how well you respond to stimulation. It's all very, very individualized. So the biggest takeaway is that your fertility medications may not match your best friends or your cousins or the person that you see online, and that's because they are customized specifically for you. The other thing that I see a lot is people think the more medications they're taking, the better their chances of a successful IVF cycle. And that's not necessarily the case. A lot of times, if you're responding well to a low dose of one medication, you're not gonna need 3 or 4 more. So it might actually be a good thing to be on less than to be on more. So keep in mind that all of this is very individualized. It's also the reason you're gonna have to go into your clinic every few days. They're gonna do ultrasounds and see how you're responding. That's how they determine your dose, if they need to add another medication, or if they need to add additional steps in your cycle to make sure that you have the best odds of it being successful.
Nuns.
Isn't that crazy?